from their break. I'm going to talk about a wide variety of pesticides, which is an overarching term, which include things that kill bugs, which are pesticides, things that kill rodents, which are rodenticides, things that kill growing plants, which are herbicides, but there's also things like algicides and molluscicides that kill specific, and even aviicides that kill birds. So all of these things are there. I'm only going to talk about the ones that were listed on the study sheet, however. So this is a classic example of Paracelsus's thoughts that all things are poison. There's nothing that is not a poison, and it's really about the dose. So if I go out in my backyard and I want to get rid of the slugs and snails eating up my vegetables, I might spray malthion around. But if I want to get rid of the lice in my kid's hair, I might use Ovide and give them a good shampoo as well. It also comes in generic, by the way. So these drugs are out there. Depending on what you want to kill and where, it's the dose that makes the difference. So as I mentioned, according to law, a pesticide is any substance that will prevent, destroy, repel, or mitigate a pest. Pretty broad classification. It includes both things that kill pests and things that repel pests. And we'll talk a little bit about insect repellents that don't actually kill the insects, but make them less likely to land on you. But we've talked about all these different things that qualify as pesticides. So with that, let's go into the mechanism of action. The one we're always most fearful of, the one that's the most potent out there, are the organophosphate pesticides. They inhibit the intercellular acetylcholinesterase, often abbreviated ACHE. ACHE breaks down choline or acetylcholine when it's in the interneuronal cleft and therefore makes it go away so it can't activate the postsynaptic acetylcholine receptor. So basically, these are drugs that inhibit acetylcholine, therefore inhibit cholinergic transmission. Therefore are cholinergic toxidromes, not anticholinergic, the opposite of anticholinergic. And we have our little memory joggers out there. There's two types of symptoms. There's muscarinic and there's nicotinic symptoms. The first one is the muscarinic, which we often use interchangeably with the word anticholinergic symptoms. These are people in pharmacy classes have often learned slud or sludge. You can read what those are there. The one we like to use in toxicology is dumbbells, because it gives you the eye findings, which is meiosis, it's kind of a meiotic eye and tearful eye, and bradycardia, the cardiovascular findings. But basically, this means that you're exuding fluids from every organ that you can exude fluids from. Tears, drooling, sweating, GI fluids, urinary fluids even sometimes as well. Here is a picture of a meiotic pupil from someone who got sprayed with nerve agents. I think this one was sent to Rob by some colleague of a colleague who was in Iraq when this person was brought in for treatment, as opposed to the opiate typical small pupil that we often think of with someone who's overdosed on heroin or opiates. These are really, really pinpoint pupils. They are tiny and non-reactive little pupils from the organophosphates. So the muscarinic effect in general is going to make you feel uncomfortable. What actually kills you are the mnemonic is the killer bees, the 3 B's that get you are bronchoconstriction, a little bit of it now from asthma, from coughing, and bronchorrhea, flooding the bronchioles with fluids, from exudation of fluids, and bradycardia. So at the point that they're starving for air, they're also experiencing bradycardia. Myself. They're often sweating, they're often drooling, they're often vomiting, they're often incontinent of urine and feces. And because of this, they're kind of a big sloppy mess to take care of, and that they're just covered with all these secretions everywhere. And potentially, all these secretions have toxins in them. So if you harken back to what we talked about yesterday, especially if we're talking about industrial strength organophosphates or nerve agents, um, you want to gown up at least level 4 gloves, gowns, eye shields for these. The nicotinic is a little bit more subtle and it tends to happen a little bit later. They block the cholinergic transmission by the same mechanism, inhibiting acetylcholinesterase, but this is the junction where the nerve meets the muscle. And so what happens here is the acetylcholine would normally cause the muscle to contract, but there's a fatigability to this. So often there's an initial fasciculation or tremor that happens, and then once that wears out, then you have paralysis. If you ever stood at the bedside when we're giving someone succinylcholine, which is unique and we're just to this thing, this is exactly what people given succinylcholine for intubation do. They kind of tremor and tremor a little bit. And once those stop, which takes about 90 seconds, then they're completely paralyzed and we can easily intubate them. Usually they need sedation, of course, because there's no action on the CNS. This is only at the neuronal motor end plate. Now, all of these pesticides were originally or simultaneously developed as nerve gases. We're not going to do the bioterrorism lecture, but just as sort of a brief, the key thing in bioterrorism we always talk about toxicologically is organophosphate nerve agents such as GA, GB, and GD, which are the German agents, tabin, sarin, and soman. And of course, sarin was the Tokyo subway used gas. Is also the V series, which is synthesized by the English and have been used in some bizarre incidents, including one where they killed Kim Jong-nam, the brother-in-law of King John Il, in an airport in Kuala Lumpur. But basically, these are stronger, faster acting drugs that do the same thing. And then there's the newest one in sort of bioterrorism terms is Novichok 5 and Novichok 7. It's 5 to 8 times as potent as VX, which is felt to be the most potent of the V series. So this are really, really bad, fast-acting agents. And this was used to kill Sergei Skripal and probably was involved in the first poisoning of Navalny. I know he died more recently, a few weeks ago, but he was originally poisoned on a plane. That was probably this compound, as best we know. So how do you treat these? It's really two parts, and each part works at a different set of those receptors. So if you want to treat the muscarinic symptoms, the sludge or dumbbells, the secretions, you can dry up the secretions with atropine. And we can give 1 to 2 milligrams of atropine, observe the response, and keep treating them until they're all dried up. If you think of all the different things we use atropine for, you'll understand why it works. So if someone's bradycardic, the first drug we use for is atropine. If somebody comes into the doctor's office and they want to dilate their pupils to make them big again, we use atropine or home atropine eye drops. If someone is in hospice care and they have trouble swallowing fluids and hypersecretions, they often use sublingual atropine troches to decrease the amount of secretions so they don't aspirate. And sometimes there's compounds used to decrease sweating for people who have hyperhidrosis that are compounded with atropine derivatives. So this will help with all of that. What do you do if atropine runs out? I mean, there's usually a few hundred doses of atropine around the hospital, but sometimes in a disaster situation, you'll run low. You can use Atrovent for the bronchospasm if that's the only thing. You can use scopolamine for eye drops, which is another anticholinergic medicine. You can use glycopyrrolate, brand name Ropanol, which is a pre-anesthetic drug used to dry people up on the way to the operating room. It's also present in some of those combo asthma inhalers, like try something or other that's on the market that's got glycopyrrolate and some other asthma medications all mixed into one. Trilogy, I think that's the one. We also have Chempack containers They're stored in a couple places around the hospital in a climate-controlled room in a big cage like this. They're sealed and alarmed, and if we have to open them up in a disaster, we can, even though the shelf life of these have expired. The FDA has granted permission to extend the shelf life up to 10 years beyond the dated use by dates. This is what's in them. Hundreds of doses of both atropine, and we'll talk about in a second, pralidoxime, as well as Valium for seizures. So the second thing we want to use, and this is mostly for the nicotinic symptoms, although they cross the blood-brain barrier and work centrally as well, is to fix the block enzyme by giving them pralidoxime, also known as 2-PAM. It regenerates the enzyme acetylcholinesterase as long as it hasn't gone through the aging process, which I'll talk about in a second. The typical dose is a couple of grams over 20 to 30 minutes, and you can repeat that. So what do I mean by aging? Some of the bonds between the organophosphate bonds that phosphorylates the enzyme acetylcholinesterase take different time periods before they become completely irreversible or aged bonds. And it varies depending on the individual compound involved. Some do it really fast, such as Soman in minutes. Some do it relatively slowly, such as VX, which actually takes days before the aging occurs. Once the aging is fully formed, that phosphorylated bond is a permanent bond, and the enzyme is completely inhibited until new enzymes can be generated. That would not prevent me from trying to use 2-PAM in anyone who's been poisoned by an unknown agent that looks like a cholinergic toxidrome agent, because I just don't know what's in it. If it turns out it was something as fast acting as Soman, it's just not going to work. But there's no downside to using it. We have these auto injectors. There's Mark 1, there's Mark 2, there's a duodote, which is a combination of these that have both atropine and 2-PAM in it. And for terrorist attacks, that's what we would recommend using. The newest version is the duodote, which has both atropine and 2-PAM mixed in the same auto injector, which looks like an EpiPen. How much pralidoxime do we use after the initial injections, which can be IM or IV? We usually recommend a drip at 500 milligrams per hour if it was a significant exposure, like somebody who went to a agricultural business and drank organophosphate pesticide out of the back of a truck, or accidentally out of a water bottle, because we know that happens all the time. They would probably need high doses for longer periods of time than a kid who probably just took a swallow of this, or someone who got back sprayed while they were spraying in an agricultural setting, where they probably just had some skin absorption and it wasn't significant. We treat with the atropine until the secretions dry up. We don't use the pupil size, which is a terrible guide, or the heart rate, which is maybe a little bit better guide, but there's other things that can affect the heart rate, like fear and anxiety. But we don't use those as a guide to stop treatment. We continue the 2-PAM until the weakness resolves, or for at least 48 hours. And we recommend a 500 milligram per hour, which is a lot. That's 12 grams per day. Remember, we're starting with 1 or 2 grams as an initial dose. We can use upwards of 12 grams per day in severe cases to maintain a constant blood level above its therapeutic threshold. So the other pesticide that's more generally available to people at home are carbamates. These work identically to the organophosphates in that they both of these chemicals inhibit acetylcholinesterase. Carbamates carbamylate that molecule, and organophosphates phosphorylate that molecule. But the difference is the carbamylation bond is weak and falls apart on its own, usually rather quickly. And so it doesn't last very long. And if you want a way of fixing that in your brain, the classic carbamate that we use as a therapy, going back to Paracelsus, is physostigmine. We give physostigmine to treat an anticholinergic delirium by creating a cholinergic crisis to combat it. And Often we have to give another dose in an hour or two because it just doesn't last that long. So aging is not a problem. None of the carbamates age. So it's okay to use atropine, but huge amounts or grams of it are not necessary. They usually don't need 2 p.m. Some older publications suggest it might be dangerous to give 2 p.m., but that's not been borne out. It's okay to give 2 p.m., but if you know it's a carbamate, it's okay to not even go down that path because the bond of a carbamate will weaken on its own. So those are the big ones that work for as a cholinergic crisis. Those are the big two that they might have you differentiate on a test question. But there's others that are out there. Um, this was a classic cartoon. I think if you're read a lot enough children's books, you'll recognize the artwork of Dr. Seuss, who started out as a graphic commercial artist. And one of his projects was to make a cartoon for the pesticide flit. So the ones that most people have access to at home are pyrethrins and pyrethroids. The pyrethrins are naturally occurring extracts from the chrysanthemum flower, and pyrethrums are derived from the active ingredient chrysanthemic acid. All of these have pretty low toxicity in humans. The only possible thing is if you're allergic to chrysanthemums, you'll probably be allergic to pyrethrins and pyrethroids. They break down pretty quickly in light and therefore they have low biopersistence. So if you spray these indoor bug sprays outside on a bright sunny day, within a few hours, the light will deactivate them and they won't kill your ants anymore or your bees or whatever else you were spraying them for. They're mostly used as an indoor spray. Now, there's two generations of the synthetic versions of these that are called pyrethroids, kind of like opiates are the original opiate-containing plant-based material, and opioids are the synthetic derivatives. Pyrethrins are the original chrysanthemums, and pyrethroids are the synthetic chemicals. So the first generation is called type 1 compounds, and they can produce the T syndrome, which is known for tremor. In fact, it's really more than just the first generation. There's second and third generation. Permethrin, for instance, is what's in Nix cream, which is what we use for head lice. They all have very low toxicity, but they have longer duration and better biopersistence than original pyrethrin does. The type 2 compounds are a little bit stronger. They produce the CS syndrome. CS stands for chorioathetosis and salivation. So they can have these movement disorders that look unusual, and they can have salivation and tremor, which makes you think you're dealing, perhaps because of the salivation, with an organophosphate or a carbamate. But don't go charging ahead with like a lot of atropine and 2-PAM. When you see someone like that, try to get the product name. And actually, I usually say, where did they get the product and what was its intended use? If it was intended for home backyard use, I can almost guarantee that it really wasn't organophosphate. The organophosphates are really limited to industrial agribusiness. Cypermethrin, some of them are cyanomethrin, have cyanide groups on it, but they do not cause cyanide toxicity. They also inhibit GABA chloride channels in high concentrations and therefore can cause seizures, so they can get kind of sick. Some of these are used like for wasp sprays, like this deltametrin is often used to spray hornets' nests. And it led to a strange phenomenon called wasping. These are two abstracts from a couple of years ago of people using concentrated IV pyrethrins as a methamphetamine substitute, which I can't fathom how that would work because pharmacologically there's nothing I can think of how they would work together. But basically, they spray the pyrethroid onto or a screen or a pipe and they heat it and smoke it. I don't know once it's pyrolyzed and made into smoke what it is active or not active, but people have gotten a multi organ system failure from doing this over and over again. Heart failure, hepatic failure, rhabdomyolysis, seizures, and chorioathetosis. Now, often these are people who are using it intermittently with methamphetamine as well. So it's a complicated pharmacology. The good news is, except for some sporadic cases, this hasn't persisted as a thing that people are using. I don't know if it's testable, but it's certainly something to keep aware of. So how do we treat these type 2 pyrethrins, the strongers? If they're tremoring and having anxiety, certainly benzos are fine. Don't go charging in there with atropine because you think it's an organophosphate, because you'll probably make them pretty tachycardic and maybe even delirious from the atropine if you use bigger doses. Um, don't go rushing in there with the cyanide antidote kit because you saw cyano something or other on the label. It doesn't produce cyanotoxicity. So most of these are be careful not to use the wrong things rather than we have a specific treatment that actually works besides supportive care, washing them off, of course, with all these and providing benzos. How do we treat head lice? Well, it's all of these things. We kind of put a whole variety of stuff in people's hairs when your kids get lice. We can put pyrethrin with a butoxide, which is a accelerant agent that helps kill lice. There's permethrins in different concentrations. This one's for scabies, this one's for lice. You can actually use malathion, a true organophosphate, in low concentrations. Or the other one that's out there, and less used nowadays, is lindane, which is an organochlorine insecticide. So let's talk about organochlorines for a second. Sorry, piperoxide is a synergistic agent. It really doesn't have any toxicity. It's only useful in animal models. But lindane is an organochlorine, hexachlorocyclohexane. Again, they probably won't use the brand name lindane. It's related to some other more severely toxic organochlorines, such as ketone, which is responsible for an outbreak called the ketone shakes, and DDT, the notorious one that, of course, Rachel Carson wrote about, killing all the birds. This one's used for scabies as a bath, a lotion, or shampoo. It inhibits GABA chloride channels and therefore works at that picrotoxin site I briefly mentioned yesterday. An inhibitory GABA agent creates a stimulatory response, and therefore the risk of excitation and seizures is significant, including hypoclonus, which is this sort of arching of the back that can happen. So these people can, if they drink a lot of it or use it too long on their body, can develop myoclonus, opsoclonus, weakness, hyperesthesia, muscle twitching, eyeball twitching, and it has a very distinct odor. If you've ever applied it, once you've smelled it, you go, you can probably identify it. So that may give you someone who's got a bunch of motor spasms and seizure and things going on. They may have used a lice product. Think of using this. The treatment is wash it off and give them a GABA agent to overcome the GABA inhibition, which is benzos usually. They are all highly lipophilic. People who use it long term have it stored in their body fat. People from that era where they sprayed DDT in the streets, and I'm probably one of them. I remember having this truck go by every summer and spray the neighborhood. Basically, they have it in there. If I was to check my fat, I'm sure little bits of DDT would be in there because it just stays forever. So a little differentiation between repellents and pesticides I sort of alluded to. Pesticides actually kill the insect. So they're used as bug spray or even lice things or things for nits. But the repellents just make the bugs not want to land on your skin when you're outdoors in the summertime. The two ones we use mostly in this country are DEET and picaridin, although people have tried a variety of essential oils, which work a little bit, but not really well for strong indications, like if you're going in an area where there's dengue or Zika, don't want to go in there just with eucalyptus oil on your arms. This is what came out is when we look at where mosquitoes are that carry a variety of diseases. Um, this is where the two spreads of the Aegypti and the albopictus mosquitoes are in the United States. Not a whole lot up where we are, but certainly in the South, they're both prevalent. But we have wood ticks, a lot of them. Rocky Mountain wood tick, I mentioned, causes a variety of things like perhaps paralysis, tick-related paralysis. So if you want to go out in an area where there's mosquitoes and ticks, DEET works pretty well. There's dozens of products that have it in it. You spray it on, hopefully in low concentrations. There have been reports of seizures in children who have had this lathered on them, especially higher concentrations above a 10% solution by overzealous parenting, perhaps, and they've had seizures. So you don't want to put the high concentration on for long periods of time. The idea is you want to wear long sleeves and long pants and just put them on the parts of the skin that are exposed, like the wrists and the ankles or below the knees if you're wearing shorts, and use a low concentration product and reapply it if it washes off after sweating or swimming. So it is absorbed. This is like the not to do thing, like spraying it on your face where you can swallow it. You could probably put ointments around your ears and neck, but not directly on your face. Now, the problem with it is there are some high concentration, long acting products that are sold in, outdoors shops like REI and whatnot, and even on the web for like military operations for people who are being dispatched overseas to areas where there's high prevalence of malaria and other risks. These are up to 33% DEET concentrations, and they should be used by adults in the appropriate setting with other clothing protection to try to prevent you from being bitten by a high-risk disease spreading mosquito. Problem with it is overaggressive application, as I mentioned, in children has led to seizures in a few. It tends to melt plastic too. So people are wearing goggles and sunglasses and sometimes camera equipment that gets it on it have melted watch faces and watch bands, and it feels very gritty on the skin. So for those reasons, maybe this isn't the best drug to use. It's got some failings here. So the thing that might replace it is picaridin. It's been available for over 15, almost 20 years now. It's a 7% spray. It was used in Europe for decades before it was released here. It lasts only about 3 or 4 hours, so you do need a reapplication if you're going to be out like all day long working. There are some suggestions that it's good against ticks. And certainly, if you're working in a tick area, that's great, but not quite superior or perhaps inferior to DEET in high-risk mosquito areas such as malaria places. The high-risk DEET is probably still recommended if you're going into a malarial area, jungle situation. So let's bring up a couple of other things that might get sprayed around your house, or your home, or your business. This is the biggest one that's come out recently. There are 3 or 4 compounds out there that fit under the rubric of neonicotinoids. They similarly bind to ACH receptors, so they are cholinergic interrupters. They don't work at ACHE, but they actually bind to the receptors and stimulate them. It's very selective to insect receptors and less so to humans, and therefore the human toxicity is really, really low. Maybe a little bit of nausea, maybe a little skin irritation, probably more so from the carrier vehicle than this. It does not cross the blood-brain barrier well. You don't get CNS symptoms with it. This is used for roaches and ants and a variety of other things. If you've had your house treated by a Terminex or someone like that, most likely one of these, like imidacloprid, has been sprayed in your attic or underneath your baseboards. The biggest problem with this and why it's limited use recently is they've been associated with these massive bee colony die-offs, where they spray it and it drifts over to someone who's a beekeeper in the next home and all the bees die off 100%. So not a very good thing. It's effective insect killer, insecticide, but unfortunately it's hard to control its drift when used outdoors. A couple other things to mention, not used a lot. Actually, I take it back. It's sort of coming back into use in a different form. Originally, boric acid or roach away, or it's good for ant or roaches. Boric acid, sort of the triad we see with that is to have blue-green vomit, which can cause a gastritis. Their skin appears boiled red lobster, and they can develop renal injury. So if they give you green vomit and a red child who ate some sort of product that they found in the garage or attic, think about boric acid. It's supportive care. Most people do fine with hydration. Their renal injury is not permanent, and they usually are fine. It's used in sort of borate powders and borate substitutes in homes again. So it's not has not gone away, but sort of these big bottles of powder that you can spray everywhere are less available than they used to be. So let me talk about some things that we do use for rodents. I mentioned the boric acid, but there are four groups that are often tested on and are on the list. The anticoagulants are the most common, bromethalin, which is mostly used now, and a couple of the things that are, one of which is pretty bad. There's lots of others. Warfarin was named after the Wisconsin Alumni Research Foundation, or WARF. Arin was the chemical they derived that was killing the cows that were eating the clover around Wisconsin, and they derived the chemical a coumarin product, which they first named warfarin and figured out it was good for anticoagulation. It was available to kill rats. They were just, I mean, literally, it said warfarin rat bait on the box, like way back when. But the problem with over generations of rats, they became resistant to it, and it wouldn't kill the grandchildren of the original rats anymore because they selected out through their strength. The ones that survived were the ones who were resistant to warfarin. So you can see this guy's about to shoot this rat, and he goes, "Whoa, whoa, whoa! How about if I try the warfarin one more time?" What came along to replace it, though, was something that was far more toxic. There are sometimes called super warfarins. The appropriate name is long-acting anticoagulant products or long-acting anticoagulant rodenticides. There are many on the market from different groups. The ones that we see the most are brodifacoum, which is that one right there. Occasionally, I've seen recently some that are difascinone as well. But brodifacoum is sort of our prototypical molecule that's involved. And the way they work is they inhibit vitamin K dependent factors and produce anticoagulation that, and the reason they're called super is that it lasts for months. Now, when it kills your rat, it doesn't need to last for months. It usually kills them. They eat. I mean, it's sort of a terrible thing to do. It's like the rats eat this, they go somewhere else, and they bleed out and die, and you have a dead bleeding rat somewhere in your attic or your basement. Not the best way to do things, but these are still out there. So here's your vitamin K cycle. I'm not sure how much of this would be important, but basically there are two enzymes that replenish vitamin K to the active form. There's vitamin K reductase that works through this intermediate here. Warfarin inhibits both parts of that loop. So if you can't regenerate vitamin K, the factors that are dependent on vitamin K, 2, 7, 9, and 10, can't be replenished. So, I mean, you could potentially send vitamin K and vitamin K2, 3 epoxy levels, but they're pretty hard to be done. Originally, there was a test to actually check all 7 or 8 super warfarin or long-acting anticoagulants by GC mass spec, run through NMS. It was canceled because there just wasn't that many cases where it became important. And most of the people who eat small amounts of these don't become anticoagulated. So the child who gets into the rat trap behind the refrigerator and eats a few pellets is not going to become anticoagulated. The person who's frankly suicidal and makes a cereal bowl full of rat kill pellets and eats them with milk, they will become anticoagulated for a very long time. Unfortunately, there was an incident that kind of foisted NMS to bring back the test that they had once stopped using. I'll tell you about that in a second. That was basically had to do with spice that was spiked with long-acting anticoagulants. People came in with bleeding and a variety of other problems. So how do we reverse? If it's just warfarin, if the INR is below 5, you just hold it. And same thing for these products as long as they're not bleeding. But between 5 and 10-ish, you could probably give them a low dose of oral vitamin K, 1 to 2.5 milligrams. Above 9, you can give oral. I hate to give it IV, but people have used it IV. But if you're going to use it IV, give it really slowly because it has a reasonably high incidence of anaphylaxis associated with it. If they're actually bleeding somewhere, It depends where and how bad. If they're in a life-threatening bleed in their brain or their GI tract or they're in shock, you want to reverse it with these products, which are Kcentra or prothrombin products. They contain all the factors in a lyophilized powder. If they're just bleeding a little bit, they have a slow oozing GI bleed, they can get fresh frozen plasma and IV vitamin K. But usually what they need is they're just anticoagulated by their labs. They have an INR that's unreadable. And it's sort of what we have to do is sort of the opposite of what we do for someone we want to anticoagulate with warfarin, where we kind of test the dose until we get them where they want. It's the opposite. We have to test the dose of vitamin K until we get them where they want. And often they need very high doses of vitamin K, 50 to 100 milligrams, 3 or 4 times a day. Now, vitamin K is a vitamin, so it's generally safe, although it tends to be very expensive for reasons I don't understand. So when you order 100 milligrams 4 times a day for 90 days, which is often how long they need it, it costs thousands of dollars, and they come back saying they can't fill it. So you have to make sure when they leave the hospital, actually someone is giving them the 90-day supply of vitamin K that they're actually going to take. Superwarfarins have half-lives of up to 50 days. There's a way of measuring them and calculating the half-life, and it can maybe help you with how many days that you need to treat them, but often it's months, 3 to 6 to 9 months, and you need to frequently monitor them, not just say, here's your dose for 3 months, come back later. So here's the incident I talked about. This is from a New England Journal article about the thing. For some reason, cannabis was spiked, or synthetic cannabinoids were spiked with rodenticide, and they never figured out why. It doesn't really enhance its high. It doesn't really make it more sellable or somehow harder to detect. But a lot of these people came in with subtle things that were easily written off. They had bloody noses or subtle hematuria or bleeding under their skin, or and so they got sent home the first time until they came in with like large hemorrhagic issues, and it was figured out that something was wrong with the marijuana. So this comes up from time to time. This is the incident that got the folks at NMS to reopen up the lab tests that they had previously discontinued for lack of use and need. So that's the most common one that's out there. Another one that's pretty bad that you should be aware of is zinc phosphide. We talked about the metabolic poisons, the electron transport chain yesterday, things like cyanide and smoke inhalation. Well, phosphide, like cyanide and azide and sulfide, all work at that same place on the electron transport chain. When you take this, you can develop severe lactic acidosis. Now, this is not the type of something you can probably buy easily, at a Home Depot or a garden shop. This is usually something that a exterminator brings because you have rats or voles or moles burrowing under your house, and they pour it in the mole holes. And unfortunately, if it gets wet, the phosphide turns into phosphine, which is easily inhaled as a gas and causes the rapid onset of toxicity. It was first registered as pesticide eons ago in the 40s. It basically controls larger animals. It's restricted to use. It's considered a hazard to non-toxic species, which means cats and dogs and children can be significantly injured. We've had a few incidences where somebody bought this, used it around their house. It rained the night and it off gas, the phosphine gas, and the children who were sleeping near the foundation in their basement and bedroom got significantly sick and died. So very scary stuff. Comes in pellets again, so rats eat them thinking they're food stuff. It's converted, as I mentioned, to phosphine gas when they get wet. It's a direct cellular toxin, acts like cytochrome C oxidase, which is the end of the electron transport chain. Initially, symptoms may be nonspecific, the sort of headache, I don't feel well kind of symptoms. There may be some irritant effects because it does have a fishy odor, which is not terribly unpleasant, but definitely is noticeable. Unfortunately, there's been instances where boats at sea have had their holds sprayed or treated with phosphine, and so the fishy odor doesn't seem to be out of place at sea where you might have fish around. And the people have ignored that, and there have been these couple of freighter disasters where people have gotten sick on them. But it can cause bradycardia, hypotension, GI symptoms, and it can rapidly deteriorate the seizure, coma, and death. How do we treat it? Wash them off. I think once they're sick enough to be treated, I think lavage is risky because it actually may release phosphine gas, but activated charcoal may be okay once their airway is protected. Perhaps even antacids and H2 blockers and proton pump inhibitors may be considered because it'll decrease the acid conversion from phosphide to phosphine. You should warn the staff that they'll be breathing some phosphine gas, and they may get a sense from the odor or perhaps even have some secondary contamination. So it should be in a room where it's easily ventilated at high volume to contain their off-gassing breathing space. But it's supportive care, benzos, moving quickly up to barbital, phenobarbital for seizures, monitor for multi-organ system, renal, hepatic, glucose, calcium, blood gases, chest x-rays, and be aggressive in taking care of them for multi-organ system issues from the lactic acidosis that occurs. I guess technically, I've never heard of a case, if you have severe acidosis that's severe enough and you're not hypotensive enough to not be able to be put on a dialysis machine, dialysis may help correct the acid-base problem. Zinc phosphide seems like a small enough molecule that it could be dialysable, but I don't think there's been any cases out there. I don't think they'll ask you, but I'm just trying to think mechanistically what else could possibly be helpful. The next up is bromethylene. This is what's in, I think, a lot of the rat poisons that we get calls on. Tomcat is one brand name. They're not going to give you any brand names. Jaguar is another one. I don't know why the name of these things. I guess it's a pretty low risk substance unless you take large amounts of it in a suicidal gesture. It also uncouples oxidative phosphorylation, although the dose amount for rats is not the same as for us. So a rat weighs one of those big green pellets will probably die, but for us, you'd have to eat multiple pellets on purpose and not just have it splashed onto you to cause significant lactic acidosis. Most, if not all of these, can be watched at home if they're accidental exposures with washing off their hands. It's been available since the 80s. There have been only, but still, 2 human deaths reported in 2005 with lots of children exposures. The outcome is varied from none to moderate, except for those early deaths that were probably intentional overdoses. These are, as a 21-year-old who presented with altered mental status a day after ingesting bromethylene, and over 7 days he was obtunded, cerebral edema, and had CNS death. And he had diffuse histologic vacuolization in his CNS white matter. So it was a CNS poison from one of those cases. Here is another article showing multiple pediatric and adult ingestions and ones who got sort of sick, but most of these can be managed at home if they're incidental. Of course, like everything else, all self-harm gestures are sent to the hospital for full evaluation. Here is another weird single drug that really defies classification. Chlorophenapure is another uncoupler of oxidative phosphorylation. It's sometimes used by pesticide exterminators, and it basically produces acidosis by disrupting oxidative phosphorylation. It's sort of notorious in that it can cause hyperthermia as well. Vitamin D3 specifically, or cholecalciferol. I mean, obviously it's a vitamin, it's a fat soluble vitamin. If you take small amounts of it, it probably is not harmful, but if you eat a big bowl full of these pellets that are used for a variety of pesticides, you can get hypercalcemic from them. It's been registered since the 80s. It's not extensively used, but it mobilizes calcium from the bones of small animals and produces hypercalcemia that kills them and then cardiovascular death is usually the way they expire. Although all animals are susceptible, rats and mice seem to be super susceptible at low doses, but cats and dogs can be at risk. You really need to take a lot of it. There are no serious human toxicity or deaths related to this, but it's not widely used. I would say anybody, once again, who takes a suicidal self-harm or amount of anything needs to be brought in and evaluated. I would probably get serial ionized calcium levels on these folks and treat them for hypercalcemia and keep them on an EKG monitoring for that time. So shifting from the rodenticides to the herbicides, there's a couple of different ones out there, or groups out there. There's the chlorphenoxy compounds, which often have abbreviations like 2,4-D, 2,4,5-T, 2,3,7,8-TCD, which is Agent Orange. The big association with these is if you're exposed to that on a chronic basis or you ingest it acutely, you can get this severe disfiguring form of acne called chloracne. These are lesser used herbicides nowadays, and certainly we don't use Agent Orange anymore. What we have used up until recently is glyphosate, which is Roundup. I hate to use a brand name, but that's what the main thing. There has been an association, but lack of proof of causation for a variety of lymphomas, most notably non-Hodgkin lymphomas, and people who have chronically been exposed to this agent on an occupational basis, like literally daily or at least seasonally applying Roundup for hours on end, have increased numbers of people who have those jobs who have been diagnosed with non-Hodgkin's lymphoma and in court cases. As far as drinking it acutely, it can make you pretty ill if you drink a lot of it. You can get a multi-organ system failure that basically is supportive care. In Vietnam, Agent Orange was a mixture of these 2,4-D and 2,4,5-T. They basically have been associated with a variety of cancers, and the VA has a list of those that if you have them and you were in field during those exposures, they will pay for your health care. What does this suggest? Someone comes in, they may give you a scenario. Someone drank out of a bottle, they thought it was Coca-Cola, or they may not use the word Coca-Cola since that's a brand name, a soda, and they suddenly had a burning sensation on their tongue. And when they stuck it out, they had a geographic disfiguration on their tongue. That's typically what would be the scenario for a paraquat ingestion. It looks brown like Coca-Cola or any cola. It's got a pulmonary and kidney toxicity that's pretty profound and often lethal, even in small ingestions. 40 milligrams per kilogram is almost always fatal. The pulmonary toxicity, interestingly enough, is made worse by oxygen. So it's often recommended to just put a face mask on it, that these folks, and not put oxygen in there, have them rebreathe their own CO2 to make them slightly hypoxemic so it doesn't activate the free radicals that are generated by paraquat. The other first aid thing is to basically have them eat any sort of adsorptive compound. Now, activated charcoal is good. Fuller's earth or bentonite, which is used in aquariums, was recommended. Clay, sand, or just plain old dirt if you're sitting out in a field and you accidentally picked up a water bottle, took 2 big gulps, and someone said, "Hey, why did you do that? That's the paraquat." You can just have the person start eating dirt from the ground. It will partially inactivate paraquat. Once they get in the hospital and they're sick, all sorts of things have been used up into including ECMO, but anti-cancer drugs like cyclophosphamide, high-dose steroids, vitamin concoctions of A, B, and E have all been used. Uncertain what really honestly works. I think on a testing situation, the things to remember is it causes progressive pulmonary fibrosis to the point where you might need a lung transplant, along with a progressive kidney failure where you might need a kidney transplant. They have nomograms that they use in other countries where these drugs are more available. These nomograms are not so much to predict who gets treated, but predict who is more likely to die, even with supportive care. So we don't really use these too much in this country. And what we do have in this country, though, is diquat, which is freely available. You can go down to Lowe's and get it, and it's good for, eliminating blackberry thorns and deep vegetation. It's just sort of a global herbicide killer. It's not as bad as the paraquat, which is a little bit different molecule. It can cause renal failure if you drink it. Certainly, if you just back spray on yourself, the answer is to just wash it off your hands and your face and, change your clothes and keep them separated from your children. But unless you drink a significant, if you drink some of it, you might be at risk for renal failure. I guess if someone accidentally drank a bottle, it was a water bottle, or purposely tried to hurt themselves, I would send them in for hydration and checking their BUN and creatinine serially over the next day or so. Um, One other variant called cyberquat is the same thing that was in that molecule MPTP we mentioned briefly yesterday as sort of a heroin alternative that was produced in the 90s that produced Parkinson's disease. These are identical molecules. This one's not on the market for herbicides. This one's no longer has had any incidences from people making fake Demerol, but they cause basal ganglia destruction, failure of the dopaminergic pathways, and severe advanced Parkinson's disorder overnight. So diquat is just renal, cyberquat, Parkinson's. A couple other things that might get brought up, Thyrem can cause an anabuse syndrome. It's sort of one of these odd used pesticides, but it's only if you drink it with alcohol. And DDC, diethyl carbamate, which isn't a true carbamate. We actually use that as an antidote for nickel carbaryl toxicity, which is a metabolite of disulfiram. So probably don't need to remember that. It's not going to come up very often. That is our pesticide story. There's lots of other pesticides out there. They like asking about mothballs. I'll probably talk about this in the household toxins, but I usually remember them in alphabetical order. CNP. The earlier in the alphabet, the older they are and the more toxic they are. Camphor could cause seizures. Naphthalene can cause methemoglobinemia and hemolysis, and paradichlorobenzene is pretty much not too much of a problem. It can be watched at home. 99% of what you're seeing out there now is paradichlorobenzene. Go back to the question box and see if anyone has any things to say. I'll wait a few minutes as you put questions. I think this whole area is very ripe for questions. They kind of like picking on stuff in here, mostly because it doesn't happen on a day-to-day basis. And there's lots of little nooks and crannies to kind of remember, unfortunately. So I have to make little flashcards for each one, like the day before the test, and read them over. All right. All right. Well, how do you think how do you think they would list lindane? Um, I mean, they may use the word lindane only because it's so commonly used and people associated with that, but it would probably be listed as that organic chlorine compound. So let me go back to the slide set again. So it's a hexachlorocyclohexane. So if you see hexa in there's not too many things that are hexa. Maybe that's the clue. There's a chlorine in it, so if you're dealing with an organochlorine, of course you need chlorine, but hexachloro is like 6 chlorines on a cyclic compound. All right. Well, we got done a little early because we started a tiny bit early, but I think we got through everything that's on that list. Um, I tried to cover everything that was listed on the study guide, but there's a couple little micro things that may have been missed or glossed over, but I'll let you study those as you prepare. All right, we'll see everyone tomorrow at 9. I think Rob leads off, and I got some stuff in the morning and all afternoon again.
Yeah. Thank you, Zane.
Hey, Zane,
See you then.
is there any way to get these slides posted before like tomorrow starts, just so I can print them out and kind of follow along?
So I think they're mostly
Are they
on
posted?
the
Let me email
in
you all
OneDrive.
where the current ones are.
Mhm.
They're tucked away in like a spy education kind of resource. I think Rob said he updated those ones already.
Okay.
I don't know if Zane's are in
I kind
there.
of put mine under these. So I put it on OneDrive. It's in a
Yeah.
folder that says C Spy Review 2024 on the
Oh, okay.
OneDrive. So all of
On
mine should, there's nine or 10 of mine that
on
are in there.
OneDrive. Can you send me the link to that one, Zane? Or am I able to I don't know if I can
I
access
think
that.
everyone can access the OneDrive, right?
Well, so the only OneDrive that we tend to use as spies is just to access the fast facts and treatment guidelines.
All right, let me try to share that one with everybody. I'll just share it with all Poison Center
Yeah.
folks and see
Yeah,
if it
that'd be great.
works.
Thank you, Zane.
Yeah.
All right.
All right, we'll see you tomorrow.